Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoyed today's podcast.
I am Dr. Colin Crowe, Assistant Professor of Family and Community Medicine at Case Western Reserve University, a family medicine physician at Metro Health, and podcast lead for Cardio's Team Best Practices. With me today is Karen Bailey, a registered dietitian nutritionist and certified diabetes care and education specialist working at Ohio University's Diabetes Institute and the Ohio Health Physicians Group Heritage College Diabetes and Endocrinology Clinic. Today, we'll talk about nutritional literacy and provide practical tips for primary care providers to recognize and address health literacy, role play for a team-based approach on in-office discussion with patients, and discuss resources for food insecurity. Welcome to the podcast, Karen.
Well, thank you for having me. I look forward to our discussion.
And thank you to Jenny Gilmore, a nurse involved in research and quality improvement at the University of Toledo, who will be joining us a bit later in the podcast.
Thank you, Dr. Crowe. I'm happy to participate.
Karen, our listeners are probably familiar with health literacy from other cardio materials, but they may not have heard as much about nutrition literacy. So what is nutrition literacy and why is it important?
Nutrition literacy is important because about 6 out of 10 leading causes of death in the U.S. are chronic diseases preventable by consuming a healthy diet. Nutrition literacy really refers to the skills our patients need to make healthy nutrition decisions. And that includes things like understanding how their food choices impact their health and how to understand information on food labels to make better food choices. And it also means that patients need to know how to communicate with health professionals about nutrition information and be able to find trustworthy sources of nutrition information.
Okay, so nutrition literacy is how to understand food label info and make choices with that information. What does the research tell us about how low nutrition literacy and low health literacy impact health?
Well, studies indicate that health literacy is a stronger predictor of good health in age, income, employment, education, and race. People with low health literacy are less likely to engage in preventative health care and suffer more chronic health conditions. They have more difficulty accessing and navigating the healthcare system. In fact, nearly half of all U.S. adults have difficulty understanding and using commonly provided types of health information, such as following directions on medication labels, reading nutrition labels, or describing symptoms. Data also show that nutrition literacy is a key factor accounting for differences in dietary habits and more healthful eating practices positively associated with higher nutritional literacy skills. In a study in which nutritional literacy scores were correlated with eating patterns, there was a strong correlation between higher nutritional literacy scores and consumption of a prudent or Mediterranean-style eating pattern, whereas low nutritional literacy scores were more correlated with a Western-style diet pattern higher in fat and sugar. You know, before the internet was a large part of our lives, data from a large landmark 2003 study on health literacy in America showed that those with low health literacy were more likely to get health information from radio and TV, not printed materials like newspapers, books, or written material on the internet. Individuals with the lowest health literacy were more likely not even to seek out health information at all.
Wow. Getting health information from radio and TV includes a lot of advertising from processed food manufacturers and fast food restaurants, not promoting healthy foods. I rarely see TV commercials about fruits and vegetables.
Right. And that can lead to so much confusion. I often hear patients say they're confused about what they're supposed to eat. They feel information's conflicting and they don't know what to believe, when actually the basic recommendations for healthy eating haven't changed for years. The dietary guidelines for Americans, the American Heart Association, the American Cancer Society, the American Diabetes Association, just to name a few, have long recommended lean proteins, fruits and vegetables, and whole grains as recommendations for a basic healthy diet. There's an abundance of good nutrition education resources out there, but it's not easy to see in the daily life of the average person. It has to be searched out, and the average busy person, especially if they have low literacy, isn't likely to search out nutrition information in the library or other sources. They may search online, but they may encounter conflicting information, some of which isn't based on research, but that's aimed at grabbing headlines like, wanting to sell a product. So that's why I feel like primary care providers, who see patients on a regular basis, play a critical role in communicating to their patients the impact that healthy food and lifestyle choices make on health and prevention of chronic illness. They can help their patients locate trustworthy sources of nutrition information. They can refer their patients to dietitians, the National Diabetes Prevention Lifestyle Change Program, and governmental and organizational websites and apps.
We know that addressing health literacy is a high priority for Healthy People 2030, which is the nation's 10-year plan for addressing our most critical public health priorities and challenges. What are some of the ways we can identify patients with low health and/or nutrition literacy?
There are some health and nutrition literacy screening tools available. Cardi-OH lists some of these in a document called Addressing Health Literacy and Numeracy, a Focus on Nutrition.
We can link to that in the show notes.
2 examples of validated quick-to-administer screens are the single-item literacy screener, and that asks one question: how often do you need to have someone help you when you read instructions, pamphlets, or other written materials from your doctor or pharmacy? And another is the newest vital sign. Patients use a nutritional label and answer 6 questions to assess health literacy and numeracy, and this is available both in English and Spanish. But another one of the strategies recommended for use in interactions with patients is to use health literacy universal precautions. This means that all interactions and materials used with patients from check-in to check-out are developed with low health literacy in mind, regardless of a patient's literacy level. Organizations can train their staff in health literacy. The Agency for Healthcare Research and Quality, or AHRQ, has a toolkit for organizations to become health literate. We can put that in the show notes too.
So what are some of these strategies suggested for communicating with patients with low health literacy?
Some of the tips I've come across a lot are, first, focus on 1 to 3 key messages and repeat them throughout your interaction with patients. Use the teach back method, and that is you provide the education, you ask the patient to teach it back in their own words, and if they don't get it right, repeat it and let them also repeat back in their own words. Try avoiding jargon and use simple wording. For example, instead of cardiologist, pulmonologist, and A1C, try heart doctor, lung doctor, and average blood sugar. Use visual aids, including written material at a 6th grade reading level or lower. And follow up with your patients. See if they have any questions. Address language and cultural differences, of course. Try to find common ground with your patient.
So we can see how health literacy plays a big role in impacting healthy eating for our patients from everything you just said. And I understand that now we're going to do a little role play to give listeners an idea of how a patient education interaction might sound. So to set the scene, we're in a primary care setting, and the office team is using the health literacy universal precautions we just talked about.
Absolutely. In this role play example, the patient's a 65-year-old female, let's name her Jane, who's here for a follow-up appointment with her primary care provider. Let's call him Dr. Smith. Jane was diagnosed with hypertension at the last visit with Dr. Smith and was started on an antihypertensive medication. Her blood pressure has improved, but it's still not at target. Her medication has been adjusted, but her doctor feels that she may benefit from a reduction in dietary sodium intake. So in this scene, Dr. Smith will start and then hand it off to Sandra, the medical assistant. And remember, all team members can use these strategies for patient care. Prior to meeting with the patient, Sandra has received training to provide low literacy education to patients using the existing tools, such as the AHRQ toolkit and the Cardi-OH Nutrition Facts food label mentioned earlier, which will be linked in the show notes. During her discussion with the patient, she will introduce the handouts while using universal health literacy precautions.
Great. And what specific communication strategies will be used in the scene?
I'd like you to listen for respectful tones, open-ended questions, getting permission to give information, affirming, and summarizing from both the provider and the medical assistant. You'll also hear Sandra, the medical assistant, use the teach-back method, which we talked about earlier. So, Dr. Crowe, you're going to play the patient, and I've got your script here.
Okay, this is so fun.
I'll be the doctor, Dr. Smith, and my colleague Jenny will be Sandra. When Sandra comes in, she'll have a cardio handout for the patient, which we can also put in the show notes.
Sounds great. Okay, are we ready?
Yes.
Yep.
All right, action.
Jane, I'm concerned about your blood pressure being high. In addition to increasing the dose of your medication, I'd like to talk to you about how your food intake can affect your blood pressure. Would that be okay?
Sure. I know I probably don't eat the way I should.
Could you tell me a little bit more about that, Jane?
Well, I don't cook much. I eat fast food for lunch and have something quick at night, like frozen pizza. I know I should eat more salad, but I don't like salad. I mostly buy canned vegetables.
Thanks for sharing that, Jane. I certainly can relate to that. We get busy, and there are times we reach for something quick, like pizza. But there are ways you can find even frozen and canned foods that are lower in sodium, which is a part of table salt, and a lot of other additives found in processed foods. Sodium is in salt and other additives. It helps to know what to look for on the food label. Would you like to learn more about how to find lower sodium foods using the nutrition facts panel?
Yeah, that would help. I look at the labels sometimes, but it seems like everything I pick up has sodium in it.
Many foods do, and some have very high amounts of sodium. Choosing lower sodium foods by looking at the nutrition facts panel will help you reach a healthier blood pressure. Would you be open to briefly meeting with our medical assistant, Sandra, so she can show you how to choose foods lower in sodium using the nutrition facts?
Sure.
Jane, this is Sandra. Sandra, please show Jane how to find the lower sodium foods by checking the nutrition facts label.
Hello, Jane. To help you learn how to find foods lower in sodium, I'm going to use this handout that explains how to do that by using the nutrition facts. As Dr. Smith may have said, you can help lower your blood pressure if you know how to find low sodium foods by checking the nutrition facts on the food label. A low sodium food has less than 140 milligrams of sodium per serving. Okay, so we have a nutrition label here on this paper for an imaginary food. Let's say a frozen lasagna. Let's use a step approach to find the sodium level in a serving of this lasagna. Would that be okay?
Okay.
Step 1 is serving size. The serving size is always listed at the top of the nutrition facts. What is the serving size of the lasagna?
It says here that a serving is 1 cup.
Right, Jane. The next step is to find the sodium in one serving. How much sodium is in a cup of this food?
850 mg.
Right. Mg is milligrams.
That seems like a lot of sodium.
Yes, I agree with you. You should look for foods that have less than 140 milligrams per serving. If it's more than 140 milligrams per serving, it's too high. If it's less, it's okay to put it in your shopping cart. Is this food high in sodium, more than 140 milligrams?
Definitely.
Great. This food doesn't deserve to go in your cart. Now that you know how to tell if a food is high or low in sodium, you can choose foods low in sodium more often and fewer high sodium foods. That will help you control your blood pressure. Lowering the sodium in your diet can be as effective as taking another high blood pressure pill. Jane, I'd like to make sure I explained how to find low sodium foods using the food label. Can you tell me in your own words how to use the 3 steps to tell if a food is low in sodium?
Okay, step 1, look at the serving size here, which is 1 cup. Step 2, look at the sodium amount here, which is 850 milligrams. And step 3, don't put it in the shopping cart. It's too high.
Well done. What questions do you have, Jane?
Well, what if a food doesn't have a label?
That's actually a great question, Jane. Fresh produce and fresh meats that have not been prepared or processed are low in sodium, but cured meats such as lunch meats, bacon or sausage, or prepared foods in the deli are often high in sodium. Don't be afraid to ask the deli server if they have low sodium deli meats, for example. If you have other questions about finding low sodium foods, Dr. Smith can refer you to a registered dietitian who can help you plan meals lower in sodium and answer any more questions you may have. Our conversation today was a good start.
And cut.
That role play was really helpful. It really doesn't take much time at a visit. It's simple and straightforward.
Right. Of course, there is a lot more to learn about low sodium eating. At Jane's next visits, we could talk about things like the percent daily value, the sodium in canned vegetables versus frozen, rinsing and draining canned vegetables, low sodium seasonings, and simple ways to prepare foods, and even sodium in pizza.
It's so crucial for us to make sure that patients understand how this affects their health. Could you provide some tips now to help patients who struggle with food costs, since that's often a barrier patients will have to eating healthy?
Absolutely. We often hear from our patients, well, eating healthy costs more, often followed by, I can't afford to buy fresh fruits and vegetables. They go to waste, and I can't afford to waste food. For many, there may be few grocers near where they live to find healthy food options like fresh fruits and vegetables. There are federal initiatives to make healthy foods available to vulnerable populations. There may be programs available that doctors don't even know about. Considering your patient's social drivers of health and linking your patients with needed resources at visits is encouraged to improve health equity and patient outcomes. There are some resources that I'll talk about here that can help providers help their patients. One place that I look is at the local health departments. Local health departments may have a list of resources in the area. Also, there's the area agencies on aging that will have information on programs specific to the elderly. There are local senior centers, and they may have senior meal gatherings, senior exercise classes, Medicare navigators, and transportation services. And don't forget WIC, Women, Infants, and Children, for pregnant women and their small children. And then one resource that you can find online is 211.org. You can go to this site, put in your patient's zip code, and find resources near where the patient lives. Then there's also, for the patient, apps they can download, like Food Finder and Find Help, if they're comfortable using apps. Providing patients with a handout with contact information on it if needed, or training members of the healthcare team to assist patients with finding resources is encouraged. Referring patients to navigation, community health workers, social services, if available, is also helpful. It's certainly a team approach.
These have been really helpful tips that can help providers quickly determine patient needs and provide the resources that might be needed. Can you give us a summary of everything we've discussed today?
Sure. Well, we define nutritional literacy, possible causes of low health literacy and low nutrition literacy, and how it affects our patients' health. And then we provided a role play for providers on how to properly address health literacy and food insecurity with patients as a physician and medical assistant team. And finally, we discussed tools providers can give their patients that are experiencing food insecurity.
We've covered a lot of helpful and important information in this discussion. Thank you so much for all of this and for speaking with us today, Karen. And thank you to Jenny for being part of the role play scene.
Well, thanks for having me. This was fun.
It was a pleasure to be part of this podcast.
And a special thank you to you, our listeners, for tuning in to Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.